How would you respond to an intimidating patient who may be emotionally abusing you and lacks respect for you? What are some ways you can gain their respect?
Well, that can be an unnerving situation, even for experienced practitioners, but the key for a situation like that is to try to remain as calm as possible, keep your composure, listen to the patient, what they have to say, don't raise your voice, and then once they're done, once they've gotten some of that out of their system, you want to find what the root of of why they're upset, why they're taking it out on you. Very often it's fear, past bad experience. So you want to be able to communicate with them that you'll work with them as a team, make sure that they're comfortable. Fortunately at UCSF, there's a very strong support network with your row faculty, your coach, and you also have the support of Dr. Centauri as well for patients who may be behaving inappropriately towards you or may have underlying psychiatric issues which may need an additional level of care.
So I think one of the biggest things when you're trying to talk to a patient is establish communication, lines of communication with the patient. At the outset itself, you try to talk to the patient. If there's a patient who's trying to dictate treatment, trying to intimidate you, let's say the patient is trying to say, oh, I'm a lawyer and I've sued these many dentists before. What you can say is, I do respect, what you have done before. I do have my own treatments. I'm going to evaluate the way that I will be doing treatment. I will come up with some differential diagnosis, some conclusions. I will explain you each and every step of the way, how I came up with that diagnosis and with that conclusion and how I plan my treatment. And then ultimately it is up to you if you want to follow through with that treatment. But the decision I will arrive at will be an independent decision because we don't want to get influenced by undue factors. So I think that's how you establish respect, that you do take into consideration the patient's needs, but you ultimately will come up with an independent decision based on your analysis and what you think is best for the patient.
So what I would do is try to ask the patient what concerns they have and try to address each of the concerns that they have as to why they're responding to the way they are. I want to understand where they're coming from and responding to me and what I've said to make them respond the way they have. So to basically first acknowledge what they say, understand that I'm hearing what they say, and then respond to what they say and attend that way. Because oftentimes what I've learned is this communication is that you talk over one another and you're not taking the time to listen and to provide that feedback. It's like, this is what I heard you say and this is what it made you feel. Or this is what you said, this is how it made me feel. So how can we better understand each other so that we can get these meds? Because we both have a common goal. We both want your oral health to be better.
How would you respond to a patient who constantly questions your experience level and skills?
I think as a dental provider and even as a healthcare provider, you will experience that many times. Many times the patient will come to you and say, oh, you look so young. When did you graduate? Did you just graduate? You can tell them, yes, this is the year that I graduated. And then you can tell them that I have passed all the requisite exams. And the Dental Board of California has provided me with this license to provide treatment after clearing all the requisite exams. When I do provide treatment to you, I will explain every step of the way that this is what is going to be. And again, if you do feel more comfortable being treated by a provider who has graduated a few years before me, and in your mind you feel that is more experienced, I can happily refer you to another provider. But ultimately, since I have been granted this license to practice, I have been deemed qualified to provide care to patients.
It's happened to me before, and actually I come straight up and told them that if they didn't trust my capabilities, then maybe somebody else would be a better choice. When somebody is like that, you're going to be at a disadvantage, and it makes you nervous and insecure. And the one thing you cannot be when you're treating people is insecure. You've got to feel totally confident that you're going to make that patient happy. So if there's any chance, or if you feel that this patient doesn't trust you, I wouldn't treat them. It's too nerve-wracking, and that insecurity can interfere with the way you treat them, and you may end up doing something wrong because of that insecurity.
I have several patients when I was practicing in Boston. having this problem for me. Okay, one time there's an Indian guy thinking that my last name HSIN Singh is an Indian name, walk into my office with his family and stare at me and say, "Oh, you are not Indian?" I say, "I'm the chief," so and then I joke with him and then calm him down, and then he said, "Okay, I'll let my kids start with you and then see how it goes." And the relationship get better and better, and then finally, before I come over here to San Francisco, they are still my patients. A lot of times the patient is because they are frightened about all these dental procedures, and it's not really attacking you personally, so don't take it personal. And a lot of times when you pick up an instrument, they say, "Are you going to kill me?" or whatever, just tell them, okay, nicely, and have a little patience. Always be genuine, be yourself, okay, and then try to stick to the facts. I always believe in all these things, and it always helps, and you will do fine.
Well, you would want to remind them that they are at a student dental clinic, so they are going to be treated by dental students, and they still have patient autonomy. They can go wherever they want to go. But also let them know that there's a rigorous curriculum at UCSF. Before you started seeing patients, you had 2 intensive years of working in the simulation lab on mannequins. So you have that experience as well as patient experience. And additionally, you're being supervised by faculty every step of the way. So they are receiving good care.
By explaining what I've done and the training that I've received, and emphasizing that I'm well prepared to do these things. And I also acknowledge my shortcomings as well, and just say if there are things over my head, I have specialists I can rely on to consult on cases to ensure that I do provide the best care I can as possible. At the same time, I would also try to help educate the patient to show what are the challenges, be real with them, so that they understand what I'm facing in order to help them provide that care. Because if through that, they still feel that I'm not experienced enough, and that's their prerogative to then go on and seek other people with other expertise. And also to at least maybe at the same time on my end to show that the way I practice dentistry is to be upfront and honest, and this is the way I engage, and if it's not compatible with somebody because that's one reason, then at least I can tell them I'll support them in finding another provider that can and address their wishes, because ultimately I want the same thing for them in the end, is to improve their oral health, even if I can't do it myself.
How would you respond to a high-maintenance patient who has unrealistic demands?
I deal with a lot of that because I'm a specialist in a restorative dentistry specialty, prosthodontics. So I see, a lot of patients who are high maintenance and have high expectations. And honestly, it comes down to being upfront with the patient, telling the patient what you can do, what you think you can do, and then actually addressing areas that you think you may not be able to satisfy the patient's expectations. One of the other things I do routinely in helping with the communication process, especially with patients that I am worried I'm not going to be able to satisfy, I always, first of all, do a very thorough exam, develop a treatment plan that I feel is comfortable, that I feel comfortable with, and that would address the patient's needs, develop some treatment options, explain that to the patient, and then follow up with the patient in a letter. And tell the patient what your findings were, what you recommend, what your concerns are, addressing their demands, and then tell them honestly if you don't feel comfortable that you're going to be able to achieve that. Or if you're willing to maybe start the treatment and kind of see how it goes, maybe do a little bit at a time, and give the patient the opportunity to see how things are going. You just don't want to back yourself into a corner with a whole practice full of really demanding, high maintenance patients, because it can take a toll on the average person.
How could you effectively and professionally respond to a patient who initiates inappropriate social conduct?
We have to remind the patient why they're there. They're there for their health, they're there for dental treatment, and also remind the patient that your relationship is strictly professional. We don't want you as students to be in uncomfortable situations, either in school or when you're a practitioner in the future. So it's important, if there's a situation like that at the time, inform your row faculty in order to figure out how to proceed. Again, if this is repeated behavior, if you're not comfortable, you don't have to treat the patient. So that's something that you would speak with the clinic director about regarding potentially discontinuing the patient.
So if a patient tries to initiate inappropriate social contact, you have to tell the patient that you are in the capacity as their healthcare provider, and you are bound by the rules of healthcare providers, ethical and legal rules. And it's between those two, ethically and legally. You cannot develop a social relationship with them outside of the care providing area where you are. So you are happy to talk to them, listen to them as a care provider, address their dental concerns. Even if they have some medical concerns around their dental treatment, you are happy to talk to them, but you are bound ethically and legally by your standards that as a dentist you cannot initiate social contact with them outside of the practice.
How would you respond to a patient who has the impression that as a provider you are taking advantage of them financially and that you are not trustworthy? Or in other words, how could you increase a patient's trust in you and your recommendations?
That's a very difficult question and something difficult to surmount. Because really, when somebody distrusts you in that manner, it's very hard to convince them that you're not trying to take advantage of them. It's especially true in the Hispanic community, where they look at professionals as individuals that want to make money off of them. So the best thing for that really takes time. You have to build a reputation within that community of somebody that cares for the community and is there to provide a service that they need and is not really out for themselves. It's really the only way to do it.
I would try to first explain the rationale as to why I'm recommending the things I am, and to explain in a logical fashion as to why they need the treatment that I'm recommending, and explaining why there are other things I wouldn't recommend in the scenario that they are. A lot of earning a patient's trust is showing that you are having their best interests in their mind when you talk. So that's how I conduct myself, to try to always be able to demonstrate that I know. If they start accusing me of trying to take advantage of them financially, then I can offer them more economical solutions and just explain why these might not work, or I can explain them why these higher financial solutions I didn't present, why they were not viable in the first place. So it gives them a spectrum as to what needs to be done, why, and also explain my thought process.
If you're ethical and act with integrity with pretty much all people, you're probably going to have a reputation as someone who is trustworthy. So if they don't trust you, I guess you could just have a conversation with the patient and just tell them that, honestly, you have their best interests for their oral health care, and that comes first.
How would you deal with a non-compliant patient who, even after you have explained the benefits of complying, lacks motivation to cooperate?
It happens all the time in the clinic to different degrees and different forms, from something like abusive sayings, abusive movements, improper touching, and all the way to maybe cultural differences in looking at things and procedures. And also the patient might be, because he or she is scared of the dentist and the procedures, patients, and be patient not only on yourself but to the patient himself or herself, and also be genuine and willing to help and be passionate and be professional, and then saying things stick to the facts, and then educating them, and I think that will help. If they are abusive and giving you trouble, you will have to stand up for yourself and then just say, well, I don't quite appreciate this way. If you can do it a certain way, then it will be most helpful. and since we have a relationship to working with each other, I think communication is important. And if this because of the cultural problem, okay, then find out what they think. Some people are against the idea of say cleaning or even brushing or even using fluoride or whatsoever. So you have to convince them that by EBD it works. I do have a patient for one time taking the tooth out and ask him not to smoke, and next thing I know is walking down the office and for my lunch, and there he is smoking on the street. And then I have to re-emphasize to him about the dry socket and all those problems, and it pounds into him finally, and then it works. And then be nice to the patient. Patient eventually will be nice back to you. So don't expect too high, but then one thing is, well, give your 200% each time, and that should work.
You're going to want to get to the bottom of why they're not complying. Is it financial? Is it fear? And then start to work with them. Also see what they respond best to. Do they need a little bit of hand holding, or do they need you to be a bit more assertive with what the consequences of not complying with treatment are? If that's not working, with every step of the way, you want to document very carefully that you discussed with the patient the risk of not proceeding with treatment and exactly how you communicated with the patient. Additionally, it's important to give the patient something written on the consequences of not complying with treatment so that they have it verbally and they have it in writing. If something like this continues to happen, you're basically practicing substandard care, and it could fall under supervised neglect. At that point, you want to talk with the clinic director about potentially discontinuing the patient if you're potentially practicing supervised neglect, and that's something that you would also consider in private practice as well.
How would you respond to a patient who has doubts about his or her treatment plan?
You can usually tell, because one of the things you have to become good at as a dentist, or even a physician for that matter, is body language. And so when somebody isn't quite sure that what you're telling them is the truth, you can usually tell by facial expressions, conversation obviously, where they question what you provided. That's a difficult one to overcome also, and there your reputation is going to come into play. Remembering that a lot of the people that you get in your practice is going to be referred to you. That's your biggest source of patients. So the fact that they've learned from other people is that you're trustworthy and that you're looking out for their best interest, along with the way that you approach the delivery of the treatment plan, will be the key to treatment acceptance and their trust in your decisions on how to treat them.
That's a common thing that we all get into, because patients have certain kind of expectations about what you can do, and if you think that you have to do something that the patient didn't expect, they might question it. So again, you pretty much have to do what you think is in the patient's best interest, and then if the patient is still questioning your treatment plan and your treatment options, you can always ask them to get a second opinion from another dentist or the local dental society or something like that, because you certainly don't want to treat a patient who's in the beginning already questioning your treatment plan. They're probably questioning other things about you if things don't go exactly the way they expect.
How would you respond to a very talkative patient who is unmindful of any time constraints?
That one's a little difficult too, but you have to pick up certain techniques. First, you got to let them talk a little bit. Obviously, they're a very gregarious person that likes to. That's the way they feel comfortable with the doctor that's treating them. But then you got to do certain physical tasks that will cut the conversation short. One of the ones that I use many times is as they're starting to talk, I will actually say, well, it's time to get to work, and I'll push the button and put the chair back. And the movement of the chair finishes the conversation, and then you get on with the work that you need to get done. So you physically stop them from talking by, making the chair, using the chair as the signal that tells the patient, we're done with the conversation, we're going to get to work.